Mac Performance. Welcome to our weekly live feed. I am excited to have you here. We're going to do a two-part breakdown of the low back because low back pain is not normal and you should not have to put up with it as if it were normal. So I'm going to make sure I have our live going so I can see who is on with us. Just give me a moment. If you are watching this live, remember hashtag live. And if you are watching this on replay, hashtag replay. Let's see. There I go. I found it. Okay. So tonight with the low back, we really need to discuss some important things. I am not talking about a medical emergency style of low back pain. A medical emergency low back pain would be symptoms of saddle paresthesia, which is a big word for numbness and tingling in the groin area, as if where your legs would hit if you're sitting on a saddle. Loss of bowel control. Those are big things. Those are medical emergencies because they can become a permanent issue, and they are from something called a Cauda-Equina syndrome. Cauda-Equina is our spinal cord ends in a bunch of tendrils known as the Cauda-Equina or horse's tail. And if there is some form of impingement in that area, it can cause that loss of bowel control. It can cause that numbness in our groin region, which is absolutely a medical emergency when that sets in acutely. That's a no bueno. We're not talking about that type of low back pain. We're talking about low back pain that could be mechanical in base. It could be from a disc issue. And we're really just going to be focusing in on how to manage those conservatively. Because here's what the research is saying. Whether you have back surgery or not, at 6 months, at 18 months, your outcomes are the same. When you have surgery for a disc or a degenerative change, you're not getting any different outcome than if you just manage it conservatively with exercise, meaning, is it really worth the risk? And that is something you have to determine with your medical team what the risk is worth. But once you have spine surgery, there's really no going back. So if we can manage it with simple exercises, that's going to give you a better outcome. And the first place is to understand what is going on with the low back. What are the muscles that can affect the low back? And when we look at it both from the outside and on the inside, what does it mean? On our second part of this series, so next week we're going to do part 2 of the low back, I'm going to throw in some actual x-ray images of different low backs and show you how you can see what's really going on and not be scared off by some of the language we use. Because we use terms like degenerative disc disease, and that can be absolutely terrifying for people. So I see we have some people tuned in with us. Hi, Paul, Rachel, Denise. Hi, Mom. It is great to have you on here tonight. We're going to jump into the low back, so I'm going to have our wonderful low back model join us while he's getting ready. I want to make sure if you're watching this live, remember hashtag live. If you're watching it in replay, hashtag replay. If you have any questions that come up while we're discussing different pieces, please feel free to ask them and we will get right to it. So here is our low back model. And I specifically have him positioned this way so we can see what's going on. Now, when he's sitting here, I'm going to put up my spine. We can see that we have our pelvis down here, we have our lumbar vertebrae, and we have our thoracic vertebrae, and then up in here is our cervical. Now, I'm going to turn it sideways, and you can see that there are some natural curves to the spine. And we can see those curves both with how the back lines up. We can see them on x-ray. But what is a normal spinal curve and what does it cause pain? And this was a discussion I was just having with some of my students. Research is showing that having a bad curve does not equal pain. What it can do is change your function. So it's important that we try to maintain a good biomechanical functional position, but there really isn't anything for bad posture, abnormal curve. So if you've been told you have a reverse curve somewhere, cool. Doesn't really matter. And we address those differently. So when we're looking in here, this is our sacrum. This is the base of our spine and really kind of creates the balance of our pelvic bowl that holds us in place. These joints on the outside are our sacroiliac joints, and they have to have a little bit of movement in there. They help us with our walking. Then it goes up into our lumbar. What I have here is this red bump is just showing what a potential disc bulge could look like. So when we're looking at an actual spine, our SI joints are down here, our sacrum is here, our lumbar spine is in here, and then our thoracic spine comes up. And a common place that we will have areas of pain or discomfort is anywhere where our spine changes curves. So we have here, we're going from a curve from the back, so a kyphotic curve, and then we're changing into our lumbar curve, which is known as a lordosis. And this area right here, where we transition, that's where we have a lot of pain. Same can be here in our change from lumbar to sacrum. Those transition areas can have increased stress and therefore have higher frequencies of pain because they just don't move as well. So these are areas that I often will help a patient to have less pain by using chiropractic adjusting and mobilizing those joints and getting them moving really well. But once they're moving, it's important for them to start building themselves up. It's really all about the movement. When we stop moving, that's when things become disabling. So in the past, when we've had patients come in with low back pain, it has been encouraged to just go rest, go lay down. Here's your muscle relaxers. Once you're out of pain, we can start moving again. And that really set people up for failure. Low back pain has the highest incidence of disability. I think it's number 2 in the world for causing disability and failure to be able to work, which that's just insane. So this is a huge issue. And within the medical community, outside of chiropractic and physical therapy, their options for managing low back pain are oral medication, such as opioids, and surgery. And that hasn't been shown to be working really well. So someone comes in with low back pain, I like to kind of see where they're at, see what their pain is, and start to get them moving. Because I need to get them moving without fear of pain and fear avoidance of activities. So if someone has more pain with sitting, that could indicate that they have an intolerance to forward movement, so flexion movements. If they aren't able to stand, they might have, if they have increased pain, they might have extension issues. So they might not be as open to an extension movement. So taking in those pieces of my exam help me determine what type of exercises I'm going to provide. But one of my favorite ones to start off with is actually a yoga pose or yoga movement, which is cat-cow, because it helps move the entire spine, which most of us aren't able to do. So I'm going to have you get into a quadruped position, which is basically just getting into all fours. And I'm going to have him go through a basic cat-cow position. So with him taking a breath in, he's going to stick his bum out, sag his belly down into the cow position. So we're completely stretching out and kind of just compressing that spine up. Then he's going to take a breath in and out, and he's going to arch his back up, tucking his tail, tucking his head, and stretching the spine all the way in. And now he's going to, with his breath, in to cow, out to cat, just kind of move through that kind of flushing of the spine. This helps me determine, one, does this person have any control of where their pelvis is in space? Because you would be surprised how many people will do cat-cow movements and only move their upper back, have no movement into their low back. So this helps me kind of see, what's your body awareness? Are you able to move? What kind of functionality do I need to help train you to get you out of pain? Then, on top of this, if there's any discomfort going on here, we can then apply some soft tissue care, such as cupping or instrument-assisted soft tissue technique, which is a really big word, which can summed up into Graston, or scraping, just to kind of help alleviate that pain and symptoms in there. If that is going well, then I will have the patient flip over and do some glute bridging. So I'll have him lay on his back, feet up on the table. Now, the first time I have anyone do a glute bridge, I simply have them press through their feet and lift their pelvis off the table. And then go back down. And I ask, did that hurt? Was there any pain? Was there any discomfort? If there was any discomfort within there, I'm now going to be like, yes, I know I can find something to alleviate that discomfort. If there's no issues, then I'm going to figure out where their weakest muscle group is and train that. So our first step is going to be looking at hamstrings. So I'm going to have them lift their toes up, dig their heels in, and lift into a bridge. And ask, better or worse? If there's no change, then we move on to the next one, which is contracting the abdominal muscles. So I have them engage their lower abdominal muscles, hold a nice tension, then lift up into a bridge and go back down. Have them relax, squeeze their glute muscles. So now we're looking into the glutes, because here's some fun facts. When I say we're going to work the core, I don't just mean the abdominal muscles. I mean any muscle that crosses into the low back core region. So it starts with the top at the diaphragm. Then it goes down all the back muscles, all the side obliques into the abdominal muscles, and then anything that crosses over that. So you have glutes, you have hamstrings, you have abductors, you have adductors, you have hip flexors, you have quadriceps. All of those can affect the low back. So if one of those isn't doing their job and another one is overcompensating and working harder than it needs to, you can have pain. So this is a great way to kind of isolate down and figure out which one is the issue. Once we activate a muscle, it alleviates the pain. I now know activating, whether it's a glute, a hamstring, or an abdominal, or an abductor or adductor, boom. I know where the basis of my rehab's going to be. Now, if this doesn't make a difference at all, that's okay. I have more things we can add to it. But this is a really nice base to kind of simply pick out where we need to work. This is where I can start with almost any level of physically active or inactive person and bring them exercises that are specific to them as a person. So we've done our abdominals, we've done our glutes, we've done our hamstrings. If I'm going to test for the abductors or adductors, I'm simply going to push out on the legs and have them lift up and go down, or I'm going to have them squeeze in and lift up. Good. Now, again, I'm always asking through this process, is there any pain or discomfort? I'm not a big fan if you're wanting to train your abdominal muscles using crunches. It's not a bad thing, but if you're already having low back pain, it can put your body in a position that could create more. So there are other ways to create a stronger core that are more functional to what you need. One of my favorite exercises is called the dead bug. And dead bug has gotten its name because when you're in the starting position, you kind of look like a dead bug with your legs and feet in the air. Now, depending upon the control that you have as an individual and what your abilities are, you might only do one leg at a time, one arm at a time, or you might do some cross-body training and do both at the same time. And an important part of this is you have to remember to breathe. And that is something that we often forget to do when we're training core, is we forget that we have to breathe. Over the summer, I had a phenomenal opportunity to work with high performance drum core athletes. And I know marching band you don't think of as high performance athletes, but I'm here to tell you these kids trained for 12 hours a day and ran and danced and jumped and performed while carrying 45-pound instruments. They were athletes. And when it came for core time, we would do planks while they sang or hummed what they needed to perform that day. And it was to help train them so that they had a strong base to do all the dynamic movements, but they could do it while breathing. So that's an important component. No matter what core activity you're doing, you have to breathe through it. And it's common, I'm at fault for this, when I get into planks, I hold my breath trying to create more stability as I have a mini earthquake because my core strength has not been good with the amount of coughing I've been doing. All right, I see we have some extra people in. John and Liz and Mark. Hello, everyone, to the live feed. Again, if you're watching this live, hashtag live. If you're watching it on replay, hashtag replay. And if any questions come up as I'm rambling through my low back stuff, please go ahead and post it down below. I want to make sure that you get the information that you're most interested in because low back pain is so common. I guarantee at least one person watching tonight probably maybe has had or has low back pain. I personally am just coming off of a really nasty low back pain episode that started in January. I know, ironic, chiropractor with back pain. But I've been managing it using chiropractic care, acupuncture, and massage, and I'm feeling really good tonight. So we've gone over some basic bridging. If we find a position in the bridging exercise that alleviates the pain, that gives you pain relief, bingo. That is our exercise, but it also is a way for me to give you back control of your body. Because although I would like to be selfish and say you have to come see me to get adjusted, to be functional, you have to only see me, I don't want to do that. I want to empower you as a person, as a patient, to have control of your own body. We have to be able to move for ourselves. We have to be able to, whatever activity you want to do, whether that be play hockey, garden, lift the grandkids, it doesn't matter. You should be able to do these activities. So, we've gone over some of the core exercises. We've gone over some of the functional movements. Here's what I'm going to tell you. I'm all done with you if you want to. Okay. I'll let him go rest. Big things is no matter what, I want you to keep moving. But if you're there can be times that low back pain can be severe. And I know, at least with me, I'm pretty bad about self-diagnosing myself with problems. I think it's medical hypochondriacism or something. So when my low back pain spasmed in January, I had numbness and tingling going down my right leg. I couldn't roll over in bed without crying. I was a mess. And I knew if I laid here or stayed in bed or stopped moving, it was only going to get worse. So for my management, I utilized heat to try to keep the muscles looser. A lot of times with our back, one of the big issues is our core, which should wrap around us like a weight belt and provide us some stability. Our core becomes destabilized, whether it's from illness, whether it's from just not working out, whether it's from working out too much and fatiguing too hard. Whatever piece has unstabilized our core, our low back tries to compensate and tightens down those muscles. And that tightening of the muscles can cause aggravation and inflammation of the nerves in that area. So for me, my QL muscles, so those are the muscles that go from right at the junction of the mid back to the low back down to my pelvis. When that muscle spasmed, it grabbed all the superficial nerves and caused numbness and tingling down my leg. And it was miserable. I tried stretching. I tried using a foam roller. Nothing was getting better. Finally, I broke down and I had Andrew put cups on my back and I was just doing the cat-cow movements. And that finally got me out of pain enough that I was able to sleep that night. Next day, I was in a chiropractor's office. I was getting adjusted. I was having an exam done to make sure that, one, my self-diagnosis was right and that I knew someone else had at least seen it, taken a look at it, and helped me kind of better come up with a plan. Because it's really hard to be objective when it's ourself. Now, tonight I've really focused on some basic, non-discriminate low back pain. I didn't dive into the discs. I didn't dive into some other more nefarious nerve. I didn't go into sciatica. I'm saving those for next week when I can also have some imaging, some x-ray, some MRI to go with it to make it a little bit more interesting. The one thing I will say is there is no perfect technique out there. There are hundreds of different chiropractic techniques. Everybody responds differently. I personally utilize diversified, and I have been trained in activator and Cox technique and flexion distraction, and there isn't one technique that will fix every low back pain. But with the right exercises and stretches, that can help and give you the best benefit. Really, what I do here, passively treating you, and when I put my hands and adjust, that's very passive care. I have to give you stuff to be actively involved. That is how you're going to get better faster and stay better longer. So if anybody has any questions, I'll go ahead and answer them tonight. Otherwise, we will see you next week for part 2, where we'll dive into the imaging of the low back and some more condition-specific low back considerations, including a brief discussion on McKinsey technique, which is phenomenal for disc injuries. And if you're watching this live, hashtag live. If you're watching this on replay, hashtag replay. And no matter what, always, if you have a question, answer it. I will go back and answer the question. But I want to thank everyone who has joined tonight. I see we've had some additions. Madison, Jeff, Lance, Ashley, welcome. I want to thank everyone for joining, and I will see you next week here on Facebook Live for our weekly live on part 2, why low back pain is not normal. Because here at Mobility Agility Chiropractic Performance, we want to help you get better faster, stay better longer, because no one has time to be sidelined. Have a wonderful rest of your evening. To keep up to date with future content, please click subscribe. Additional information is found in the description of this video.
All information, content, and material of this video is for information purposes only and are not intended to serve as a substitute for the consultation, diagnosis, and/or medical treatment of a qualified physician or healthcare provider.